Good evening, everyone. I'm Dr. Asritha. I'm working as a consultant developmental and behavioral pediatrician at Andhra Hospitals, Vijayawada. Today, I'm going to discuss few cases on hyperactivity child. So, I want all of your active participation at the same. So, I am give you some scenarios. Kindly, everybody else, yourself. Whenever you are ready for the answer, unmute yourself, give the answer, or else you can type the answer in the comment box. I kindly request all of them to put your mics on mute so that I can talk. Thank you.
సరే నన్ను అలాగే
Everybody else to mute themselves. Hope everybody can hear my voice. Am I audible? Am I audible? Yeah.
Yes, ma'am.
Yeah, thank you. So I'm going to give you some case scenarios. I require all of you to actively participate in the session. So coming to the first case, so all of you can see the screen, right? So a 5-year-old male child was brought to me with complaints of not sitting at one place. He's very fidgety, does not get along with the sibling, slaps the sibling, and he cries a lot when his needs are not met. Does not know how to behave in front of relatives, and he has trouble not understanding the rules of play. This is what the mother was giving me the complaints. So I have probed and I have asked for antenatal, natal, and postnatal, which is uneventful, and milestones were normal. So what do you think I should ask further? I mean, like, what are all the other questions you want to, you as a pediatrician are going to ask the mother's child or the caregiver? Language means specifically you want to ask about the developmental milestones is what you are suggesting. Yeah, okay. The milestones were normal, sir. Family history, specifically, what should I ask for in the family history? Any parents suffering in childhood with a similar complaints is what you are asking. So what we are going to rule out by asking that question? Yeah, right. How many settings that the child is having the symptoms? Like you mean like is the child duration of present symptoms? Okay, it's present for more than a year now. And the child is having the similar complaints at home itself. Other behavioral abnormalities. Okay. Like So the questions you have posted in the chat box are quite relatable. So we need to, I have already asked about antenatal, natal and postnatal history. So that history was uneventful and the duration of symptoms is very minimal, like only for less than around 6 months. But the setting, he was only behaving like this at home. So I came to a diagnosis of over pampered child. So we need to counsel the parents. Yeah, sibling rivalry is a common event, but he doesn't understand how to behave in front of relatives. He's not waiting for his turn while playing games, or he's not sitting at one place. He's very active and he's very fidgety. So you should not get carried away with the symptoms they are presenting. So you need to ask all these kind of questions, like how he is behaving at school. Are there any academic concerns at school? So how are the symptoms with other settings? So you need to ask all these questions before giving a diagnosis. So coming to case scenario 2, a 4-year-old female came with the complaints of hyperactivity. She's running a lot. She's not following commands. She's staying aloof. Okay. She's repeating rhymes and numbers. She insists to eat from the same plate and she's not at all following the commands. And she gets frightened of dark lights. These were the complaints by the mother. And when I watched, birth history was uneventful and there is a speech delay in the milestones and her hearing and vision was normal. So what could be the diagnosis of this child? You want me to show the complaints again? Yeah. There is some speech delay also and there is nothing else positive history. Okay, why it is ADHD, sir? And why you think, Shreya, it is autistic behavior? You can unmute and talk also, there's no problem. Anyways, we are just 33 people, so we can talk among ourselves. Okay, repetitive behavior is there. So mainly the diagnosis. So anybody else is going to answer? Yeah, right. The diagnosis is autism spectrum disorder because there are a few complaints which are suggestive of having a social interaction problem, like staying aloof. Okay, and also there are not following commands. Okay, and there is a repetitive behavior like repeating rhymes and numbers and insisting to eat from the same plate. So, so if there is a symptom of hyperactivity, don't rush to the diagnosis of ADHD. Okay, so you need to carefully look for all the complaints. Coming to case scenario 3. So there is a 7-year-old male child came with the complaints of again hyperactivity, poor attention, and there is poor academic performance, dislike to sit in online class. This is during my COVID times when I got to interact with the parents. That was the case scenario. Does not appear to listen. Okay. delayed reply to questions when asked, never finishes his homework, and he is easily distracted and always interrupt conversations, and he has no friends. So when I've asked for birth and family history, it was uneventful, milestones were normal, and there is no speech delay also, hearing and vision was normal. So what could be the diagnosis? Okay, why ADHD? Okay. Yeah. But again, don't forget to ask whether the symptoms were present in two different settings or not. And also for how many months the mother was observing these kind of changes. Okay. Because he's staying aloof, he's not able to follow, he's not paying attention to the questions when they were asked. So there is a delayed reply to the questions. Okay. So I hope you are all with me. You are able to understand what I am intended to tell. What I am trying to put it in front of you, right? You're able to understand, right?
Yes, ma'am.
Okay. Coming to next case scenario, there is a 12-year-old female child with the complaints of academic concerns again, and there is inattentive towards academics since the new academic session. She was good in academics till last grade, okay? She is avoiding to learn new concepts. When asked about it, girl was reluctant and she's avoiding the questions. And again, she's staying aloof and she's not talking to family members.
Which one? Did you see the CT film?
This one.
No. This COVID negative. For
That
that
one,
case.
Maharaja.
No. Durga. See the CT film? Bada sa most probably lymphoma or germ cell tumor, I think.
Tomorrow only.
Confirmed.
But history is very less now.
Yeah.
How?
I don't know. What is the history?
So what do you
4
think
days only,
about
ma'am.
this case scenario? So when I have asked about family history, there
That's
were
the-
conflicts present and
The
girl
child
aware of it
may
also.
not have noticed and all.
Sorry, can everyone kindly mute their microphones so that the
I
class
told
can
her.
proceed?
We can sir.
Which one?
Perfection दे दिया ना आपने. I have not told Nikhil sir को बोलना है.
I request everyone to mute themselves, please.
This is regarding autism, na?
It's not. It's taking a long time.
Functioning slow.
Yeah. So can you please answer the question? So what do you think is the diagnosis for this child? What is adjustment disorder? And why you think it is happening? Why you think there is a child abuse here? Year, okay. And since new class, she has changed, okay. But what is the definition for the adjustment disorder? there anything like that? You might think exact term, Shreya. And sir, yes, we have to probe the questions regarding child abuse, and as you rightly pointed out, we have to think about child abuse too. But why you thought about child abuse in this scenario? Change in behavior, yes. Yes. So there were academic concerns, you are right, and she is inattentive and she's very reluctant. When you are asking the questions, she's avoiding that. She was giving the answers like, no, I don't want to learn. And she was good in academics till last grade, but suddenly there was change in her behavior. So we need to probe if there is any kind of say child abuse happening or any kind of bullying at school. Okay, why she's not talking to family members. Okay, all these things are probing or leading us to that kind of diagnosis. So when we have asked, the child was having query anxiety. It's not adjustment disorder, anything to new settings. Okay, sudden change in behaviors and very drastic change in your academic performance. You should always think about anxiety, which might be the presenting complaint, but you should always probe about the cause of anxiety also. Okay. So there was always you will get a complaint saying that my child is difficult to your clinic. So have to go from here. So when do you suspect? What do you suspect? How they'll present to you? So when and in whom to suspect, if they are coming to you that my child is difficult, they have any academic concerns or any behavioral problems, and they have few symptoms of inattention, hyperactivity or impulsivity, especially in the child or any adolescent age group, then you need to evaluate for ADHD. Okay. So what do you mean by ADHD? What is ADHD? It is a most common neurobehavioral disorder of childhood, and it will continue throughout your adolescent and also adulthood. So in India, the prevalence is 9.4, and among male children, it is 9.4, and among female children, it is 5.2. And it is characterized by hyperactivity, inattention, and also impulsivity. And how do they present to you? In preschool age group, they'll present to you as a behavioral disturbance. In school age, they might have behavioral disturbances, academic issues, any social interaction issues, and self-esteem issues. Then you should rule out autistic disorder also whenever the child is presenting with you with some behavioral disturbances, hyperactivity, and social interaction issues. Then you need to probe for autism first. Okay. So in adolescent, they'll present to you with academic problems and also social interaction issues and self-esteem issues, drug abuses, and also any injuries or accidents. In college, they might have some along with academic problems, they might also have some occupational difficulties and also self-esteem and substance abuse issues, and also injuries and accidents and some risky sexual behaviors. All this you can see when in the college age group children, college age group presentation. In adults, how do they present? They present as occupational failure, self-esteem issues again, and also relationship problems are more common in adult age group. And also substance abuse might be most common presentation in adults. So what are the causes of ADHD? Mainly it is genetic modified by environmental factors. So what are the genetic factors? If the siblings have ADHD, there is a 2 to 3 times greater risk. And heritability, it is like around 0.7 to 0.9% risk is there if the ADHD symptoms present in parents or any other family members. What are the environmental factors that are affecting, like severe marital discord or low social class, large family size, maternal mental disorders? All these are the environmental factors that is affecting the genetic material. So what are all the other factors you might see, like in low birth weight or pregnancy or delivery complications or traumatic brain injuries or any prenatal exposure to alcohol or nicotine? All these also might affect your genetic material. So what exactly happens that leads to ADHD? So there is a genetic predisposition happening due to environmental factors. These are affecting the genes which are associated with the dopamine pathway. So if you do any neuroimaging, there are few studies where they have done some neuroimaging in ADHD children, which have suggested there are changes in the anatomical structures in brain, like total brain size reduction or reduced dimensions of several brain areas, particularly prefrontal cortex, corpus callosum, and cerebellar vermis. In these areas, they have seen there is a reduction in brain size, which will lead to the dopamine release, and dopamine will control your executive functionings. So, any genes associated with dopamine pathway might lead to your ADHD. So dopaminergic dysfunction and noradrenergic regulation imbalance mediates the core symptoms of ADHD. This hyperactiveness, inattentiveness, or impulsivity is mainly due to this dysfunction. So what are the symptoms you can see? So in school age children, in inattention, they are difficulty. There might be symptoms like the child is having difficulty to focus. Child will become bored with any kind of task within few minutes. They don't complete the assignments. They sit and they will not focus on a task when they have given. Okay, they can't follow the instructions. They won't listen to the people when the people are talking to them, and they're easily confused. These are some of the symptoms you might observe in inattention group. In hyperactivity, they have very trouble. They can't sit still. Okay, during any school time or at home, or when the child when the parents are doing the story time, and they're always fidgety or squeaking in the while they are sitting, and there is non-stop talking, and there is fidgeting in their seats and all. These are few of the symptoms in hyperactivity.
That for germs and tumors.
I request everybody to mute themselves.
PTHC.
And that is germ cell tumor.
Germ cell tumor. Alpha fetoprotein and PTHC for the germ cell tumors, and this one it is for you.
So impulsivity, they have features like they are very impatient. They blurt out answers inappropriately. They have difficulty in waiting for their turn. And they might show some emotions without any restraint. So what is the age of presentation? Generally, hyperactivity, impulsivity symptoms you might typically observe around 4 years or sometimes earlier also. So it increases, the hyperactivity symptoms might peak up to 7 to 8 years of age. Thereafter, it begins to decline. So in adolescent years, you may generally, it is very hard to recognize. Even you can diagnose ADHD in adolescence, but the thing is the hyperactivity symptoms might not be recognizable in adolescent years. So there will be more restless, or they can't sit at one place. Those were not the typical hyperactivity symptoms. That will be peaked till 8 years of age. So inattention symptoms, you will identify late. You will not see until the child is 8 to 9 years of age, because they will be going into deeper academic sessions, and then the little bit attention is required to solve their math problems or something like that. Then they will come to you with those kind of symptoms. So how you will diagnose, how you will how you will make a diagnosis of ADHD. So for confirming diagnosis, we will see DSM-5 diagnostic criteria. Okay, what are the mandatory points that are made sure in DSM-5 is your symptoms should be present prior to age of 12 years. It means even if the adolescent is 13 or 14 years old, the symptoms should be there prior to the age of 12 years. I think you understood the point, okay? And you have few points in few symptoms in inattention, a few points in hyperactivity, impulsivity. So 6 or more symptoms must be present for at least 6 months of age, for at least 6 months of duration. They should have a negative effect on their social and academic activities and occupational functioning. And these symptoms should be in 2 or more settings like home, school, with friends and relatives, all those things. And symptoms should not be explained by any other mental disorders or any other psychotic disorders like schizophrenia and all. So you need to rule out all those disorders prior when you are giving a diagnosis of ADHD. So what are the assessment tools available for diagnosing ADHD? So first thing is, but the diagnosis is not made alone. Okay, when you are suspecting ADHD, you feel when you are taken a complete history, you have done a interview kind of thing, you have taken a clinical history, you rolled out all other psychotic disorders, then you need to apply certain tools. Those are like DSM-5 for ADHD or 4. Okay, then there is a child behavior checklist where you will give a questionnaire to parent, teacher, and there is something called self-reporting also. If the child is adolescent, you will give it to the child to self-report about him or herself. And there is the scale called PONUS 3 abbreviated rating scale. For again, there is 3 settings: parent, teacher, and self-report. And then there is Vanderbilt assessment scale, and then the thing most of the Indian pediatricians they use is INDT ADHD. That is a freely available indigenous tool. It will be available on your mobile phone also. You can do it in your daily practice. And there is something called BASI. This is Behavioral Assessment System for Children that is available for parent, teacher, and also child. So preschoolers, we can evaluate using any DSM related rating scale. Like whether when DSM-5 is not available, we can use DSM-4 scales also. So what are the subtypes that are present? What are the types of ADHD? So predominantly hyperactive impulsive type is there, and then there is predominantly inattentive type, and there is a combined hyperactive impulsive and inattentive type. And what are the severities? According to DSM-5, there is mild symptoms and moderate symptoms, and then severe symptoms. So what are all the other differential diagnoses you can make for ADHD? So mental disorders, all the other disorders, anxiety, conduct disorder, opposite defiant disorders, autism spectrum disorders, okay, intellectual disability, all this are the differentials in mental health. And in medical, you have to do thyroid, your hypothyroidism, neurodegenerative disorders, frontal lobe tumors, Fragile X syndrome, Angelman syndrome, any seizures. All these are like these are the differentials in medical. And in drugs, when there is a drug abuse like cocaine or steroids, and if you are taking the child is on a longer period of antihistaminics, the child also might present to you as ADHD. And if there is severe abuse or any neglect, all these kind of children also they'll present as ADHD. So what are the comorbid conditions that are there? So anxiety, depression, oppositional defiant disorder, conduct disorders, substance use. All these might be uh, coexist with your ADHD also, and you have to differentiate also whether they are alone or they are with ADHD or not. So that will come by when you are interviewing the parent and also the child you are observing, and when you are applying a proper assessment tool, you can make it out. And what are all the other developmental conditions that coexist with ADHD? Learning disorders, language disorders, and also autism spectrum disorder. And in physical conditions, you have tics, sleep apnea. These are all the things that will exist with your ADHD. So what are the modalities? How do you manage? So behavioral intervention, it is the first line of treatment for preschool children. Medication is also play with or without behavioral interventions, are the first line of therapy for school-age children. That is above 6 years. Your first line of treatment will be medication part. If the child is less than 6 years, the first line of treatment will be behavioral intervention. So there are some educational interventions also, like tutoring, resource room support, and classroom modifications that are done in educational intervention. And there is always a combination therapy, like medication plus behavioral intervention, or medication and also behavioral and educational interventions. So how to manage if you're diagnosing ADHD and if the child falls into your preschool age group 4 to 6 years, then you will take first line of intervention as behavior therapy. If there is no improvement, then you'll go for pharmacotherapy. If your child is above 6 years of age, then you will try with pharmacotherapy. And then if there is no improvement, you will additionally give behavioral therapy. Always assess the child. If at all required, the intervention is taken whenever it is required. Okay. So what are the available pharmacotherapy in India? Stimulants, we use methylphenidate. The dose is 5 mg per day, first day, followed by 5 mg twice a day. Okay. Duration of how much duration does it keep the child attentive is 3 to 5 years, and 3 to 5 hours. And the side effects will be tics, mood liability, decreased appetite, hypertension, not taking food properly, and there is a you have to always monitor weight and also see the growth of the child. Okay, what are the non-stimulants that are available? The other line of management is atomoxetine. These are monoamine reuptake inhibitors. And we start with 0.5 mg per kg per day for minimum 3 days, and then we'll increase to 1.2 milligram per kg per day after at least 3 days. So first you will start with 0.5 mg per kg for 3 days, and then you will increase 1.2 milligram per kg. So duration of action is 10 to 12 hours, but the side effects is again there is growth, transient growth it affects the transient growth, and also there is GI distress, and there is also sedation. These are the few side effects I have mentioned. So generally we use methylphenidate as the first line of drug. If at all it is not working out, then we will try for atomoxetine. So the choice of medication is methylphenidate may be given into preschool children if indicated. So school-age children or adolescents, stimulant is the first line of agent, as I told you, followed by atomoxetine. So what are the other medications you can use? Alpha-2 adrenergic agonists are usually used when child responds poorly to your stimulants or atomoxetine, or whether child has an or any significant coexisting conditions are there, then you can adrenergic agonists. Can you please mute yourself? So what are the myths around ADHD, that all hyperactive children are ADHD? It's a myth. So you need to probe the history, you need to take the history in detail, and also you need to apply the exact scale. and then only you should diagnose ADHD. And it is not only childhood problem. Once the child is having a ADHD, it will continue in his adolescent and also adult age. Only boys doesn't have ADHD, but due to the cultural differences, maybe you have higher incidence in boys, but girls also do have ADHD. And you're poor parenting, or you're always seeing negatives in your child. Your child is okay, you are doing a difficult parenting. No, that poor parenting will never cause ADHD. Only genetic predisposition will cause ADHD. And how you are behaving with child matters the most. So as a pediatrician, when you conduct a developmental surveillance, you just look for the risk factors, ask for the behavioral issues, and also take a complete developmental milestone history, and also look for hyperactivity, any developmental delays, any behavioral issues and academic issues. When the child comes to you for fever, cough, cold, take 2 minutes extra and ask for any simple antenatal history, natal history, any significant. Then you probe for behavioral issues, ask for the milestones, how they are doing, any developmental delays. It will just take 2 extra minutes. So do the developmental surveillance. So what are the take-home messages? It is a very common misdiagnosed entity, and you should always think of autism. If the child is having hyperactive, you ask for the social interaction. How is the child behaving? Is there any eye contact, or are any repetitive behaviors, anything else? But if the child is especially a very toddler, in a toddler age group, and high risk, if there are any high risk children in your clinic, try to do the developmental and behavioral surveillance. And we can pick up the issues early, and we can start the interventions early. Okay. And you should always know before diagnosing ADHD what is the normal behavior for that particular age. Okay, and you should have a detailed assessment before jumping and starting on medication. Don't put methylphenidate if you see any hyperactive child, or any risperidone or atomoxetine, just because I have told you today that is the first drug of choice. So don't do that. You should do a detailed assessment before jumping to the diagnosis, and if you're starting on any medication. Thank you so much. If you have any doubts, you can put it in the chat box.
Recently, we have come across some of the products from the representatives like DHA, DHFA, like rich products to improve the myelination of the brain.
Okay.
So, what is your opinion on?
Sir,
example, cost 3. So one
yeah.
person has come with cost 3.
Yeah, one thing is DHA and everything are way costly. That might add as a supplementation to your brain, but it will not reverse your core features or anything, either for autism or ADHD. So it is like if you are prescribing a Zincovit, how it will support your child health. That's it. It's a kind of supplementation. That's it. But it will not reverse any kind of core features for autism or ADHD or any other neurodevelopmental disorders.
Oh, can you tell us a little bit about Asperger's syndrome?
Sir, previously Asperger's syndrome was a different entity, but after DSM-5, they have included everything under autism spectrum disorder. Asperger's syndrome, they generally say that the child is having a good IQ, but they have a difficulty with social interaction and repetitive behaviors. So even DSM-5 for ASD says the same thing. So right now, they are not naming it as Asperger's syndrome. They are naming it as, or they're giving a tag as autism spectrum disorder itself. So we are not using Asperger's syndrome as in such. So if the child is having any social interaction issue with repetitive behaviors, we are applying the scales and we are diagnosing them after 3 years of age. So there is no separate entity like Asperger's syndrome.
Ma'am, as a pediatrician,
Okay, sir.
so what we need to tell to the parents if they bring a child with ADHD, we know that, but we can't diagnose with all those DSM-4 criteria because we don't have that much time. So we need to do some kind of assurance or what they need to do at home. Please kindly.
So, sir, actually, ADHD, if you are feeling that yes, this child is having few symptoms of ADHD, first reassuring the parents regarding the diagnosis, then strengthening and it is very independent. You can't give all the tips to every parent. I mean, like it won't work out for all the children. So first you need to have a detailed, at least detailed behavioral interview with the parent where the child is having difficulty in attention, what kind of activities, for example, the child is having inattention mode. So what kind of task is not able to do. Then giving a token reward system. I hope you know the term called token reward system. So you're asking the parent to strengthen the positive behaviors of the child by giving a token, by rewarding the child when they are performing certain desired positive behaviors. So by the end of week, these many tokens the child have collected, and they are encouraging the strengths of the child and also reinforcing the child with the positive behaviors. So this is one kind of thing you can say. You can say the timeout system also for the child. You might and also have to change the environment at home, how they need support, and explaining the child is having this kind of symptoms to the school. I mean, like school authorities also changing, giving a few breaks to the child, keeping the child in the first bench, first asking whether the child is having any academic issues or any problems at school setting also. Then you can ask or request your school authorities also to do this kind of changes. Okay, so it is like dependent on each child, how they are presenting to you. So broadly, I can tell you tell this token reward system, a timeout system, and changes in the school, requesting for extra help from the school authorities, not to giving negative punishments to the child at home, or labeling him as a lazy person, he or she. So all these things we can suggest to the parents, and you can always suggest them to go for a help where there is a holistic approach for this kind of issues. So first thing is reassuring the parents regarding the diagnosis thing, telling the tips, 2 to 3 things. If you give extra 5 minutes to the child, or the parents, you might know what exact the core feature is, or where the setting, in which sitting the child is having more problem. So there you can again suggest. So that way it is.
Do you have any idea regarding the centers in Andhra Pradesh and Telangana, to where are all the setups you have to, so that to have a better approach to these children with autistic behaviorism?
Sir, actually, at Andhra hospitals, we have already started a child developmental center where we have everything. So there are few child developmental centers working. I mean, it depends on the area where you're working. And sadly, the parents are taking a simple remedy to that particular approach. Like if there is a speech delay, they are going for a speech therapy. If there is a motor delay, they are going to like physiotherapy, like that. But generally, there should be a holistic approach. So it requires a team of people, and it is quite upcoming. And if you are staying nearby Vijayawada have 3 to 4 centers where the holistic approach is being implemented. And we should also know about the special schools where in Andhra Pradesh, where especially the area where you are living, where they can support autistic children also, and also ADHD children. And generally, actually, every school should have this inclusion criteria, and also inclusion schools, if they have inclusion schools in your area, all those things. But if I tell you I think like few of the places, they have already started a child developmental centers where they have at least 4 to 5 people under one roof. Like your ideal therapy or your resource center should have a lead who is leading all the therapists, okay, and also they should have a physiotherapist with a proper psychology who has trained in child psychology, who can deal with the kids who are having behavioral issues, and also all these neurodevelopmental disorders, and also occupational therapists, and also they should also have a special educator, and also a dietitian and an audiologist. Especially, at least these criteria should be satisfied if you're sending a child to a center, and they should have covered all these kind of services at least. So in major cities of Andhra Pradesh, I think they have good developmental centers. And even the government have started this district early intervention centers. So I don't know whether the resources are very good in all the places, but few of the districts have a good DEIC, early intervention centers.
Is Andhra Hospital is going to start a center in Visakhapatnam, madam?
That part I don't know, sir.
Child Development Center, not about the hospital.
That I think they have a plan of starting it, sir.
Yeah, it's highly required here.
I will just convey the message to.
Yeah, thank you.
Any other questions, sir?
There are certain seizure disorders which behave like this. Can you tell us a little bit about it?
Yes, sir. So you have to rule out all the comorbid conditions. So always seizure disorder with any, especially anti-epileptics like levetiracetam are causing way kind of behavioral changes in children. So definitely seizure disorder might be, or also recently if the child is having any chronic illness like allergic rhinitis, or if they are on any antihistaminics also, they are presenting with ADHD. But again, your main tool for diagnosing ADHD is your history. So it should be like, it's not like the seizure disorder will not present with ADHD, but you need to take the proper history, whether the symptoms are present in 2 different settings, how the child is behaving since when he started all this. I mean, here the child has this kind of symptoms. So yeah, I can't tell you the list of seizure disorders that might act as ADHD, but yes, definitely. And even the anti-epileptics might also be the cause, especially levetiracetam, mainly the behavioral changes, especially in male children. That's what I was observing, and also there is a proper research that is going on the same. So they are changing it to levetiracetam generally. That's what the recent advances says.
Okay, thank you, ma'am.
And I'm really happy that proper developmental questions everybody is asking this time. I'm so happy. I'm open for any other questions, or if at all any other kind of CBD you want, especially from DP, developmental pediatrician, I'm ready to prepare and do it next time. Any area to focus on? Any suggestions? Okay, thank you so much. We'll meet after 15 days again with some other different topic. Thank you so much for the active participation.